Okay, so now looking at the side of the skull. So again, frontal bone up front here, parietal bone, temporal bone. You can see kind of the sphenoid bone right here as well. And the lacrimal bone is right here inside, just inside the nose. Okay, and the zygomatic bone. Now our zygomatic bone has 3 processes. So you can think of these processes as named after what they touch, not what bone they're on. So this projection here, okay, this is the temporal process because it touches the temporal bone. This projection off to this side, okay, this is my maxillary process because it touches the maxillary bone. Then you have your orbital process up on top, so this projection touches right here where the orbital is. So that's your orbital process. On the temporal bone, you have this process here, touches the zygomatic bone, so it makes it our zygomatic process. Okay, you can see down here, this large protrusion here, that's the mastoid process. You have a large hole here where your ear would be. This is your external auditory meatus. Okay, so along our mandible. Okay, so the mandible, again, you can see that mental foramen right up there in the front. You can see the ramus, which is kind of this whole region right here. Okay. The mandibular condyle, so that's what comes back here, connects to the back of the jaw. The mandibular angle is down here. The cornoid process is this front projection. So you have cornoid and mandibular condyle. Okay, the back of the skull, not as much to see as the other angles there, but you can still see your parietals up here, your occipital bone. This large projection off the back here is the external occipital protuberance. Can't really see too much else from this view. You can see, if you look down right here, on the mandible bone itself is the mandibular foramen. Okay, so the mandibular foramen's in the back of the jaw, while the mental foramen was on the front of the jaw. Okay, so we're looking at the top of the skull here, and we can see clearly the frontal bone, your 2 parietal bones. Those are separated here by the coronal suture. The 2 parietal bones are separated by the sagittal suture. Okay, underneath the parietals, you can see your occipital bone. Okay, the occipital bone is separated from the parietals here at the lambdoid suture. On the side, see your temporal bone, the zygomatic bone right here around the eye. The maxilla bone is the top part above the jaw. The jaw itself is the mandible. And this little protrusion is the vomer, where it sticks out. We have 2 nasal bones here. We open up the skull itself and look on the inside. You can see your ethmoid bone sticking out kind of right here in the middle. You have this, what I kind of think looks like a butterfly shaped bone here called the sphenoid bone. Okay, so now we're looking at the front of the face. So we'll start kind of up top here. So here's our frontal bone. We've got the glabella right here between the eyes. The supraorbital ridge, kind of where your eyebrow would be. Supraorbital foramen and or notch. Got your 2 nasal bones again. Okay, so inside the orbital here, so our eye socket, you can see way back in the back, there's this large crack right back in here. Okay, so that's our superior orbital fissure. Right down in the middle of the nose here is your perpendicular plate. Off to the side, this is my inferior nasal conch, so you can see it here as well as here. Then you have a middle nasal conch, which is another ridge just above that. It's a little deeper inside there, so harder to see. You gotta look down in there. Our maxillary bone here. So we have our infraorbital foramen. Along the margin where the teeth come in, so this is my velar margin, so it's on top as well as on bottom. Okay, so on our mandible here, we can see these little holes here on the bottom. So one here, one here. These are our mental foramen. Okay, looking at the underside of the skull now. So we can start up here and see our palatine bone, the palatine process just above it. You have the pterygoid process, which you can see are these kind of ridges poking out along the sides here. Okay. You have two processes that you can see. So this one projection right here is the styloid process. And again, you can see the mastoid process is a larger one right behind it. You have, of course, the large hole. That's where your spinal cord is going to come in, the foramen magnum. Just off to the side of it is the occipital condyles on either side, where it's going to articulate with the skull. The spine articulates with the skull. Okay, now we can look at the inside of the skull. So starting from the top, so in our ethmoid bone here, we've got the crista galla, which is this projection here, which is surrounded by the cribriform plate. Okay. Of the sphenoid bone, you have the lesser wings, which is just this region right up here, and the greater wings, which is this lower section here. Okay. This saddle-like structure right here, the sella turcica. The petrous portion is this raised region right here. So this is where your auditory canal would kind of go through. So if you remember, you had the external auditory meatus here and your internal auditory meatus, which is where it would come out right here.